I'm a nurse practitioner at Mount Sinai Hospital. I'm part of the internal medical associates, and I work with the hepatitis C team. When we first started treating hep C at Mount Sinai, we weren't providing primary care. We were just treating the hep C, and that was it, right? And they would go to whoever they were seeing. But we quickly realized that a lot of these patients don't have primary care providers, and they were missing that key component. We felt that we already gained their trust with the treatment of hep C, and they actually liked coming to us because a lot of patients say, you know, this is the first program where people actually listen to me. I feel accepted here, and they're really happy to keep coming back to see us. I think that also knowing that they're coming to us for primary care and hep C makes them more willing to want to be treated for hep C and more compliant with it. I learned that one of the most important things is showing compassion and actually listening to them. So every time I meet a new patient for hepatitis C, I always come in knowing that I need to treat everyone individually. I think the most important thing is that we teach them how not to become infected. I also make sure it's important for them to know that when we're treating them, we can cure them, but it doesn't make them immune. Compliance with the medication regimen is really the most important part of getting cured. If they take them every day, around the same time, don't miss any doses, then they have a really good chance. So part of the initial visit is really trying to get an understanding, what barriers they have to doing this, and then working with them to make sure that they can get through the treatment. People who are homeless, right, who live in shelters, who don't have access to food because you're supposed to take it with a meal, who don't have access to water, drinks, they forget to take their pills with them. That's a big important part of it too, if they're not living in a central location. One person once told me, you know, you changed my life. You know, this news changed my life for the better. And now I can go on living, working, and I don't have to worry about this anymore. When you hear that, it means you're doing something good. The message is that you don't need to be afraid. It's very treatable. There's no stereotypes. We accept everyone. We treat everyone individually, and we'll help them reach that goal of being cured, whatever it takes.